So today we will discuss thoracic sympathetic chain and splanchnic nerves. Okay, so this is a content of the posterior mediastinum, thoracic sympathetic chain and the splanchnic nerves. You have seen in the dissection part this sympathetic chain. Yes or no? No. Okay. So this sympathetic chain, it is a part of autonomic nervous system. So autonomic nervous system comprises sympathetic nervous system and parasympathetic nervous system. Sympathetic nervous system, it is active during fight and flight, and parasympathetic nervous system, it maintains the relaxed state of the body, that is it helps in digestion and metabolism of the food. আচ্ছা এটা ইকো হচ্ছে কিছু মনে হয় দেখো না So these are the main functions of sympathetic nervous system and parasympathetic nervous system. See, this is the sympathetic chain. Along the chain their ganglia are present, sympathetic ganglia are present. Okay, this is spinal nerve. Spinal nerve preganglionic fibers are entering into this ganglia. Here it is relaying, and after that postganglionic fibers are coming out through this Gray Rami Communicantes. Okay, preganglionic fibers are entering to the sympathetic ganglia via the white Rami Communicantes, and postganglionic fibers are coming out through the Gray Rami Communicantes. Okay, and you can see the preganglionic fibers are starting from the lateral horn cells. Here, lateral horn cells of the spinal cord. See, along the on the two sides of the vertebral bodies, this is the location of the sympathetic chain, and from here the spinal nerves are going laterally. Okay, nerve roots are coming out through the vertebral foraminus from the spinal cord, and they have connections with this sympathetic chain via the gray and white Rami communicants. The small things are the Rami communicants. Here it has been shown, gray and white Rami communicants, and after this relay it is going through the spinal nerves. The nerves are passing through this spinal nerves to supply different organs. The autonomic supply is from this sympathetic and parasympathetic. And from the medial side, these branches you can see, these are the splanchnic nerves. From 5 to 9 ganglia, they are giving fibers to form this greater splanchnic nerve. 10 and 11 joints to form the lesser splanchnic nerve, and 12, from 12 we are getting the smallest splanchnic nerve, that is least splanchnic nerve. Okay. Okay, so we will discuss the sympathetic nervous system. It consists of preganglionic fibers, sympathetic ganglions, and postganglionic fibers. Preganglionic fibers, they arise from lateral horn cells of T1 to T11 spinal segment, and they have spinal cord. They leave the spinal cord through the ventral motor root, and they join the ventral primary rami of the spinal nerves, and these fibers enter the sympathetic chain through the white rami communicants. Here it is arising from the lateral horn cells, coming out through the anterior motor root, entering into the ganglion via the white rami communicants. Okay. Sympathetic ganglia, it is a chain of autonomic ganglia. Preganglionic fibers relay in this chain and may be at the same level or at a higher level. Okay, fibers can go 1 or 2 level higher for relaying through this chain, relaying at this ganglion. And postganglionic fibers, they leave the sympathetic chain and join the spinal nerve as the gray rami communicants. Okay. Next, they join the vessels. Here from this ganglia, postganglionic fibers are arising, and they are passing through this gray rami communicants and going through this spinal nerve. and they join the vessels to reach the destination in the head and neck. Around the carotid vessels, carotid plexus are formed by these sympathetic nerves, okay, carotid plexus, and so they are generally lying around the vessels forming plexus, these nerves, sympathetic nerves, fibers, and these fibers also form splanchnic nerves that supply the thoracic and abdominal viscera. Okay, you have seen in the previous picture, these are the splanchnic nerves. Medial fibers are joining to form the splanchnic nerves, and lateral fibers are giving supply to the head and neck, forming the carotid plexus in thorax and abdomen, thoracic and abdominal different plexuses. Okay. So sympathetic ganglion chains or sympathetic trunks, they lie on either side of the vertebral column. On the two sides of the vertebral column, this is the location, and it has cervical, thoracic, lumbar, sacral and coccygeal parts according to the name of the vertebrae. Okay. In the coccygeal region, both the sympathetic chains, right and left, fuse to form a single ganglion impulse. Okay, at the lower end, these two chains will fuse with each other to form a large ganglion known as ganglion impulse. It lies at the level of C2, coccygeal 2 vertebra. Okay, CO2. Next is thoracic. Here we are mainly discussing the thoracic sympathetic chain. Okay. So sympathetic ganglion forms a chain in the thoracic region, and that is situated one on each side of the vertebral column. Continuation, superiorly this chain is continuous with the cervical part, whereas inferiorly with the lumbar part of the sympathetic chain. How many ganglia are present? Developmentally, there are 12 ganglia in each thoracic sympathetic chain. Okay, 12 vertebrae, 12 nerves, so 12 ganglia are present. However, first thoracic ganglion fuse with the inferior cervical ganglion to form stellate or cervicothoracic ganglion. Okay, so first thoracic ganglion fuse with the inferior cervical ganglion. There are three cervical ganglia, superior, middle and inferior. So inferior cervical ganglion fused with the first thoracic to form the stellate ganglion. This is stellate ganglion is very important, comes as a short note or important for your MCQ viva, how the stellate ganglion formed like this, or part of theory question. All other to second to 12th thoracic ganglia, they lie at the level of corresponding intervertebral disc. Okay. So what is the communication? Communication is gray and white rami communicants. This. So each thoracic sympathetic ganglion is connected with corresponding spinal nerve. See, this is spinal nerve, and this ganglion is connected with the spinal nerve via this gray rami and white rami communicants. White rami communicants contain the preganglionic myelinated fibers from the lateral horn cells of the spinal cord, and gray rami communicants contain postganglionic non-myelinated fibers. Okay. What are the branches of this sympathetic chain? The branches of sympathetic trunks are grouped as medial branches and lateral branches. Medial branches, these are visceral branches for the thoracic, abdominal and pelvic viscera. See, these are the medial branches. Medial branches from upper 5 thoracic vertebra, 1 to 5. Okay, they are not taking part in formation of splanchnic nerves. These are preganglionic fibers. They supply heart, great vessels, lung and esophagus through formation of these plexuses. Pulmonary plexus supplying the lungs, cardiac plexus supplying the heart and great vessels, aortic plexus lying around the aorta, esophageal plexus supplying the esophagus. Okay, so first to fifth thoracic fibers, these are taking part in formation of these plexuses. Medial branches, two medial branches from 6 to 12 thoracic ganglia. They are preganglionic fibers from lower 7 thoracic ganglia and they join to form the splanchnic nerves. Okay, rest of the 5 to 9 is forming the greater splanchnic nerve, 10, 11 join to form the lesser splanchnic, and 12th is continuing as the least splanchnic nerve. Next is lateral branches which are passing through the spinal nerves. Lateral branches supply the limbs and the body wall, and they are pilomotor, pseudomotor and vasomotor to supply the cutaneous areas. Okay. Each ganglion gives Ganglia Rami Communicantes and that joint corresponding spinal nerves and supply the body wall and the limbs. Splanchnic nerves are we will discuss the splanchnic nerves in details. Splanchnic nerves comes as a short note, okay. So you prepare as a short note, splanchnic nerves. So important question is stellate ganglion, another is splanchnic nerve. First we will discuss the greater splanchnic nerve. How it is formed? It is formed by preganglionic fibers arising from 5th to 9th ganglion. Course, it descends by the side of the thoracic vertebra, pierces the crus of the diaphragm and joins the celiac ganglion. How it terminates? It mostly terminates in the celiac ganglion and few fibers join aortico-renal ganglion and suprarenal gland. Okay, so this is the formation, course and termination of the greater splanchnic nerve. Next we go to lesser splanchnic nerve. It arises from the 10th and 11th thoracic ganglia. It descends downward and pierces the crus of the diaphragm. Termination, it ends in the aortico-renal ganglia. Next we go to the least splanchnic nerve, also known as renal nerve. Formation, it is the small and lowest splanchnic nerve. Arises from the 12th thoracic ganglion. Course, it descends downward and passes along with the sympathetic trunk behind the medial arcuate ligament of the diaphragm. Medial arcuate ligament is one ligament from where diaphragm is originating. Okay, diaphragm originates from 3 arcuate ligaments, median, medial and lateral arcuate ligaments, okay, which are arising from vertebral body and the ribs. So, it is passing behind the medial arcuate ligament of the diaphragm. That's termination, it ends in the renal ganglia. That's why the name is given renal nerve. Least splanchnic nerve is also known as renal nerve because it ends in the renal ganglia. Okay. So these 3 nerves you have to prepare for your short note, splanchnic nerves. Next we go to the clinical aspect. In clinical aspect, Horner syndrome comes as a short note, okay. Horner syndrome is important. Here sympathetictomy, thoracic sympathectomy. We are cutting the sympathetic chain to relieve pain sensation, okay. See here, this is azygous vein. Intercostal veins are draining into the posterior intercostal veins are draining into this azygous vein. In the upper part, these are the intercostal artery and this is the intercostal nerves which are connected to this ganglions via the gray and white rami communicants, and here splanchnic nerves are arising. Okay, so and here we are cutting along the sympathetic chain. According to the symptoms, we have to cut at different levels. So cardiac pain, sympathetic fibers from T1 to T5 spinal segment carry pain sensation from the heart through the dorsal root ganglion on the left side, and here the cardiac pain is referred along the medial side of the left arm, forearm and upper part of the front of the chest. Okay. And thoracoabdominal sympathectomy, it is done in case of severe hypertension. Thoracoabdominal sympathectomy is performed and it involves the surgical removal of T5 to T12 ganglia and excision of the splanchnic nerves. Okay. So in severe hypertension, thoracoabdominal sympathetictomy is done. Next we go to the Horner syndrome. This is important short note. Horner syndrome, injury to the stellate ganglion. Stellate ganglion is formed by a fusion of T1 and inferior cervical ganglion. Here mainly T1 sympathetic fibers are damaged in Horner syndrome. Causes Horner syndrome, it is also called oculosympathetic paresis. Mainly near the eyeball there is paresis. It includes ipsilateral symptoms, that is in same side involvement. In which side sympathetic chain is involved, that side symptoms you will get. So there will be meiosis, constriction of the pupil, paralysis of the dilator pupillae muscle. Dilator pupillae helps in dilatation of the pupil. So if it gets paralyzed due to loss of this nerve supply, T1 sympathetic nerve supply is lost, there will be meiosis, constriction of the pupil. Then there is ptosis. Ptosis due to weakness of superior tarsus muscle. Anhidrosis, there is decreased sweating and anophthalmos, posterior displacement of the eyeball. Okay, so these are the 4 symptoms you will see, okay, in Horner syndrome. Here you can see the constriction of pupil, drooping of the upper eyelid, that is ptosis, and also you will see anhidrosis and anophthalmos. You can see this is normal side. You can see the eyeball prominently. Here it is pushed posteriorly, anophthalmos. Okay. So in last view, you can see ptosis, meiosis, constriction of pupil, anhidrosis, and anophthalmos. Next is Raynaud's syndrome. This is also important theory question, Raynaud's syndrome. Okay. It is a condition in which spasm of the arteries cause episodes of reduced blood flow to the fingers, toes, lips, nose and ears. Okay. There will be spasm of the arteries. Sympathetic supply is vasomotor. Vasomotor means it controls the muscle in the wall of the arteries. Okay. So in case of there is abnormal supply, there may be spasm in the arterial wall and it will lead to reduced blood flow to the fingers, toes, lips, nose, ears like this. An affected part turns pale and on the return of blood flow, it causes burning sensation. Okay. When the spasm is released, suddenly the blood flow is restored and there will be burning sensation. To treat the Raynaud syndrome, the upper limb sympathetictomy is done. Excision of the ganglion chain above the level of stellate ganglion. That means at the cervical level, you have to do the sympathectomy. It will relieve some of the symptoms of this Raynaud syndrome. So this is summarization of the thoracic sympathetic chain. It lies one on each side of the vertebral column. Ganglia developmentally, 12 number of ganglia are present, but first fused with the inferior cervical ganglion to form the stellate ganglion. Communications are gray and white rami communicants. White rami containing the preganglionic fibers and gray rami containing postganglionic fibers. Branches are, there are medial branches and lateral branches. Medial branches are visceral branches. From 1st to 5th ganglia, they are forming 4 plexuses, pulmonary, cardiac, aortic, esophagus, to supply the lung, heart and esophagus and great vessels. And from lower 7 ganglia, they are forming the splanchnic nerves, greater, lesser and least splanchnic nerves. And lateral branches are passing through the Gray Rami communicants and supply the limbs and the body wall. Okay, so this is the supply. And clinical aspect here it has been discussed. Cardiac pain referred through T1 to T5 routes. Thoracoabdominal sympathectomy is done for treatment of severe hypertension. Horner syndrome, it occurs due to damage to the T1 sympathetic fibers or damage to this stellate ganglion. Okay, and upper limb sympathectomy is done for treatment of Raynaud's syndrome. Okay, these clinical aspects are very important for sympathetic chain. Okay, you all of these can come as a short note as a explain why question. Okay, and Splanchnic nerves comes as a short note. And stellate ganglion is important for your question. So for question you prepare short note for stellate ganglion, splanchnic nerves, and all these clinical aspect you prepare as a short note. Okay, Horner syndrome is very important, and Raynaud's phenomenon or Raynaud's syndrome can also come as a theory question. Okay, and these are also explain why questions. Cardiac pain referred through which root values are important, and thoraco-abdominal sympathectomy, why it is done. Okay, Raynaud's syndrome, sympathetic nerves, they are supplying the muscles in the wall of the blood vessels. Mainly muscles are more prominent in arteries. Okay, so if there is abnormal supply of this sympathetic chain, so there will be spasm of the arteries. Spasm means constrictions, okay, at different levels. So Raynaud's syndrome is condition in which spasm of the arteries cause episodes of reduced blood flow to the fingers, toes, lips, nose and ears. Generally these areas are involved. So in affected part turns pale, and on return of blood supply, during spasm there will be less blood supply, and when the spasm is released, blood supply is restored. Okay, so sudden blood supply, there will be pain or burning sensation generally, because blood is its temperature is hotter. It mainly 37 degrees centigrade temperature is maintained, and when blood supply is less, the temperature is reduced at this part. So that's why there will be the burning sensation, and to treat the Raynaud's syndrome, the upper limb sympathectomy is done. Why upper limb sympathectomy? You can see the involved parts are the finger, toes, lips, nose, ears. They are at the upper level. The supply of these areas are coming from the upper level mainly. So that's why upper limb sympathectomy is done. Excision of ganglion chain above the level of stellate ganglion we generally do. Okay, it is useful to relieve the spasms and this to relieve these burning sensations. Okay, understood? Okay, sit down. Any other queries? This is very important, grey rami and white rami, which is containing preganglionic, which is postganglionic. Important for your Viva and MCQ. See, white rami is preganglionic and grey rami is postganglionic. Okay.